afternoon. Okay, we have a personal care module bathing tips. And this is the home health aid service for July. So we'll start out on page 1, the joys of bathing. Imagine you've had a rough day at work. You're feeling sweaty and tired. You're looking forward to going home, taking a nice, hot, relaxing shower. Now imagine how it would feel if instead of being able to simply hop in the shower, your physical condition required you to take your clothes off in front of a stranger, hold on to grab bars because you're afraid of falling in the shower, ask for help washing your private areas of your body, stand and shiver while waiting for someone to bring you a towel. Suddenly, the idea of a nice hot shower doesn't seem so appealing, does it? Your clients used to be able to take care of their own bathing needs. Now many of them need your help, and they probably aren't happy about that. Being dependent on others for bathing probably makes them feel old and useless, ashamed, and scared about what else they might have to give up doing for themselves. Bathing clients requires patience, strength, compassion, and skill. For some clients, it may also require special equipment. Next page. The purpose of bathing. Bathing is important because, number 1, it cleans the body and removes dirt and dead skin cells. New skin cells continually push older cells toward the surface of the skin. By the time skin cells reach the surface, they are made up of the same lifeless protein as your hair and nails. Number 2, promotes comfort by cooling and refreshing the skin and relaxing the client. Most Americans consider bathing to be a source of comfort. Think of all the products that are available to make bathing a pleasant experience: bubble bath, bath oils, shower gels, etc. Number 3, control body odor by removing bacteria and germs from the skin. Body odor is caused by a combination of sweat and bacteria. The main source of odor are the armpits, the groin, and feet. Some foods, such as garlic, cumin, and curry, can cause body odor to linger. Number 4, prevents infection. Skin defends the body against injury, infection, harmful substances in the environment. But the skin must be clean and intact to do its job. That's where bathing comes in. Number 5, it provides an opportunity for clients to move their muscles and joints. By encouraging your clients to do as much as possible for themselves during a bath, you help them remain independent and provide their muscles and joints a bit of exercise. Number 6, stimulates circulation. Blood flow in the body is increased by warm water, rubbing or massaging the skin, and by moving the joints and muscles during the bathing process. Number 7, it helps prevent skin breakdown. It's especially important to clean the skin of incontinent clients. When the skin is exposed to urine and or stool, the risk increases for developing pressure sores and infections. And number 8, gives you opportunity to communicate with your client and observe his or her body for changes. Bathing is the number 1 most consuming task for caregivers. Make the most of this time by checking your client's body for changes and making a pleasant conversation. If your client is unable to speak, try singing or humming instead. If you're singing, it's better, don't do that. I can hum too. Making observations at bath time. Bath time gives you a terrific opportunity to observe your clients for physical change. Keep an eye out for problems and report any changes right away. Check the hair and scalp for head lice. Lice can happen to anyone, no matter how old or young, dirty or clean, rich or poor. Look for white lice eggs known as nits. They look like small bits of dandruff but do not wash or flake off. Instead, they are stick firmly to the strands of hair. As you comb or wash the client's hair, observe the scalp for scaling, crusting, irritation, bruises, bleeding, lumps, or large areas of missing hair. Look over the whole body, making notes of any areas of redness, rashes, bed sores, moles, and other changes in the skin. Check the entire body for puffiness or swelling, broken skin, redness, bruising, or bleeding. Report any unusual body odors, a strange odor may be a symptom of an illness. Watch out for clients who seem to sweat too much, too little, or tend to sweat a lot at night. These are medical conditions that can cause sweating problems. In fact, it can be life-threatening if a person doesn't sweat at all. Look for white or yellow areas on the finger and toenails. Your client may have a nail fungus. Check for itching, cracked skin between the toes and the soles of the feet. They're a sign of infection such as athlete's foot. Watch for black warts on the soles of the feet. Let's go to the next one, which is bed bath.
On the bottom, Susan, what is that picture of next to the ear? It's on page 3.
That's, looks like skin cancer. Skin cancer is the most common form of cancer. There are 1 million new cases diagnosed every year. You can watch your clients for signs of skin cancer, including sores that don't heal, a mole that changes side or has irregular edges, the growth, skin growth that changes color, especially if it turns red, white, or blue, a mole that becomes tender, itching, or dotted with black spots, and a skin growth that crusts over, cracks, or bleeds. You good?
Good.
Bed bath. Encourage the clients to assist with bed bath as much as possible. Gather all your supplies ahead of time. Close any doors or windows to avoid drafts and to ensure both warmth and privacy. Cover the client with a light cotton blanket. Uncover, wash, pat dry. Only a small part of the body at a time. A sponge or partial bath. A full bath may be ordered for each of your clients every day. However, a person's face, underarms, buttocks, and genital area should be washed daily. Following each client's care plan, for example, Mrs. Smith may be allowed to stand at the sink for a sponge bath, but Mr. Taylor needs to sit at the edge of the bed. A tub bath. Never give a tub bath unless it's ordered for the client's care plan. Tub baths have high risk for clients' falls, burns, and chills. Encourage clients to use the toilet before a bath, since warm water may trigger the need to urinate. Don't attempt to keep a client in or out of the tub unless you feel secure. To help a client in or out of the tub unless you feel secure about your ability and or you have the proper equipment to lift them out, like a side or lift. Tub baths can dry the skin, so they shouldn't last longer than 20 minutes. What? Okay. Maybe that's just for our clients and not us. Shower. Never give a shower unless it's ordered in the client's care plan. Use a shower chair if ordered. Be sure to place a rubber mat on the shower floor and don't cover the drain opening. Remember that a sitz bath is meant for soaking the hips and buttocks only. It is often used with the clients who have had surgery in the rectal area or have had bladder, prostate, or vaginal infections. Some clients may become dizzy after sitting in hot water. When the sitz bath is over, help them stand up and make sure they are steady before attempting to walk. Pat your client's hips and buttocks dry with a soft towel. Okay. Let's go to the next place, bathing clients with special needs. Seriously ill clients. Clients who are seriously ill, dying, or in pain require some extra tender loving care during bathing. Keep these tips in mind. Help the client into a comfortable position. Complete as much bath as possible in that position. Proceed slowly if the client's experiencing pain, shortness of breath, or anxiety. Schedule the bath for about 1 hour after pain medication has been given to the client. Confused clients. Clients with Alzheimer's disease or other conditions that cause confusion need special consideration at bath time. Remember that the confusion may make them afraid of everyday things like running water, cold tile floors, or soap. Overly sensitive to temperature such as cold drafts or hot water. Especially embarrassed about undressing in front of you. To help make the bath time more enjoyable for the clients, try to set up a routine for bathing and stick with it. Give simple care instructions without arguing. Avoid showers for clients who are afraid of running water. Fill the tub before taking the client into the bathroom. Keep the bath water no more than 6 inches deep. Cover the client's upper body with a towel to provide privacy during the bath. And play soft music or sing to the client if he or she finds music soothing. Bathing is more difficult and more time-consuming and more dangerous for people with disabilities. Clients with disabilities may have trouble keeping their balance while bathing or transferring in and out of the tub. Reaching items such as grab bars, soap, or towels. Holding onto a bar of soap, opening or closing a faucet, feeling the temperature of the water. You can help your disabled clients by following proper bathroom safety precautions, making sure there is enough light in the bathroom, putting needed items within your client's reach, and getting assistance from a coworker or a family member when transferring a client by yourself would be dangerous.
That's if they want to help
Skincare products. There's many types of soap, plain, medicated, perfume, moisturizing. Check your client's care plan, specific types of soap that should be used at bath time. Questions: when is soap considered a drug? Answer: a bar of soap becomes an over-the-counter drug if the manufacturer claims the soap works against dandruff, bacteria, perspiration, or acne. Use mild soap. For clients with dry skin, apply soap only to the face and underarms, genital area, hands and feet. Clean the rest of the body with warm water only. Rinse soap off with warm water, not hot. Powder. You may be asked to apply powder to soothe the client and cool the client's skin. If so, use only a small amount of powder and do not mix powder or lotions. This causes the powder to crust and cake on the skin, which can irritate the skin. Avoid shaking powders in the air. If inhaled, the small amount of particles may irritate the client's respiratory tract. Bath oil. Bath oils are used to soften the skin and keep it from becoming dry. Some are also perfumed. Do not add bath oil to a tub bath. It can make the tub even more slippery and is hard to clean off the surface. Instead, if bath oil is desired, apply a light layer to the client's skin after the bath. Deodorant. There are two kinds of underarm products. Both deodorants are antiperspirants, help to cover up body odor. However, antiperspirants also work to control sweating. Some of these products can cause skin irritation, especially if used immediately after shaving the underarm. Check your clients for rash or other skin irritation. Creams or lotions. Lotion or cream is used to soften skin and prevent it from drying. Encourage your client to apply lotion themselves if possible. This gives them a chance to move their muscles and joints. Before applying lotion, warm it up by rubbing it between your hands. Apply the lotion gently, especially for elderly clients who have thin, frail skin. Let's do bathing and infection control. My page is over. If you help a client with toileting right before bath time, don't start the bath while wearing the same pair of gloves. Throw away your dirty gloves, wash your hands, and put on a clean pair of gloves. When cleaning a client's eyes, wipe each eye with a different corner of the washcloth. This prevents spreading infection from one eye to the other. Change the bath water whenever it gets too soapy, it cools off, or becomes contaminated with body secretions. Practice standard precautions during the bath process. For example, wear gloves whenever feces or urine are present, a client has open sores, or you give perineal care. Always clean a client's perineal area from front to back to avoid spreading germs from the anal area to the urinary area. Use a separate clean washcloth for this part of the bath. Collect soiled towels and washcloth and place them in an appropriate laundry bag or container. Be sure to keep them off the floor. You may want to review the policy for handling dirty linens with your workplace. to find out whether you are required to wear gloves when handling linens. Let's go to the next one. Bathing and safety. The greatest danger in bathroom comes when clients get in and out of the shower, the tub or shower. The risk of falling is high. As you assist clients in and out of the tub or shower, you are at risk for falling too. Most of these double falls happen at the end of the bath when the client is tired or relaxed. If a client's physical condition has worsened, or while transferring a client out of the tub because the client's body and tub, the floor are wet and slippery. Your clients may be physically dependent on you for help at bath time. For example, a client with arthritis may not be able to turn the water faucets on and off. A client may also be psychologically dependent on you. For example, he or she may be afraid to take a bath alone for fear of falling. Whether the problem is physical, psychological, or both, keep each client safety in mind at all times. Try the following tips. Wear rubber-soled shoes when assisting clients at bath time. If you work in client's home, have access to a cell phone, consider keeping it in the bathroom at all times, or during bath time. You'll be able to call for help if you or your client fall. Make sure there are non-skid mats inside and outside the tub or shower. Keep the bathroom well lit during bath time. Make sure it is well ventilated too, so that the room doesn't become too hot. You and your client may become faint in the heat. Remember that older people are more sensitive to heat and cold. Test the temperature of the water before the elderly clients get into the tub. Shower. If you use a thermometer, it needs to read between 105 and 110 degrees Fahrenheit. After reading the thermometer, test the water on the inside of your wrist. Consider asking your client to do the same. I'm kind of skipping some, now I need to skip some of the ones that are bath related because we don't look at baths. Grab bars. Grab bars come in various designs, including horizontal, vertical, diagonal, wraparound. They may be mounted to the wall, floor, ceiling, or tub. Some bars have ridges in the middle and are covered with vinyl to make them easier to grab. Grab bars don't do any good if they are placed too high or too low for the clients to reach. Most people need bars installed in two different positions, one for use of getting in and out of the tub and in the standing position, and one for lowering or raising the body from a seated position. Let's go to the questions. Ready? Number one, if your clients have dry skin, you should add bath oil to their bath balls. Bath oils may help moisturize the skin, however, because oil can make the tub more slippery, it is best to apply a light layer of oil to the client's skin after the bath, not in the water. Number two, a client with Alzheimer's disease may be afraid of everyday things like running water or a bar of soap.
Yes.
True. Remember to be patient and compassionate with confused clients. Try to get to the bottom of their fears and avoid them if you can. For example, if a client's afraid of running water, fill the tub before you bring the client into the bathroom. Number three, the most important area to clean during a partial bath are the face, underarms, buttocks, and genitals.
Yes.
True. Some clients may not need a daily bath, however, the face, underarms, buttocks, and genital areas usually need to be cleaned daily.
So that's what partial is now.
Correct. That's why these areas are included in a partial bath. Number 4, a sitz bath is used to soak a client's feet and lower legs. False. A sitz bath is used to soak the hips, perineal area, and are especially good for people who have had recent rectal or perineal surgery. Number 5, one purpose of a bath is to A, keep the skin from becoming dry by soaking in the water. B, give nursing assistants something to do. C, remove dirt and dead skin scales from the body. D, decrease blood flow to the body, or in the body.
B.
C. That was a good guess, but the answer for number 5 is C. Bathing removes dirt, dead skin, and cells from the body. Number 6, during bath time, you should observe your clients for A, moles that are changing in shape. B, white lice, eggs in the hair. C, cracked skin between the toes. Or D, all of the above.
All of them.
D.
All of them.
All of the above, that's right. Number 7. To avoid an infection, the perineal area should be washed from blank to blank.
Front to back.
Front and back. By washing from front to back, you avoid bringing germs from the rectal area toward the urinary system. Number 8. Grab bars. A, may be placed in horizontal, vertical, or diagonally.
Yes.
B, help clients gradually slide their bodies into the bathtub.
No.
C, direct water to hard to reach body parts.
No.
And D, are never used in showers.
No.
A, depending on how they are able to be used, grab bars may be placed horizontally, vertically, or diagonally.
What do you think of those plastic ones that they press them and
The
then they
one with
flip?
suction on them.
Some are good, some are not.
I was
Yeah.
told
Put
that
it on
every
the
time you use it, you have
surface.
to dry and then
Some
reinsert
work,
it,
some
because they'll,
work, some work. Depends on the wall.
yeah.
But every time I have one, I always just pull on it myself.
Mhm.
Sometimes a good way, sometimes a good. I'll wipe it off and read to it.
Yeah.
So they don't get in, because then they freak out after that.
I got a lady who's using like the shower knobs and it's in her son's, at her son's house and I'm like, you need bars, you need, and she says, well, but she's too embarrassed to ask the son or.
Can
it's
you,
like
can
she's
you
like-
mention something? Is the
Yeah,
sun home when you're
well, 'cause
there?
I mentioned the bar to her, she's all those, Miss Sun said that those fall off, I'm like, no, like I have one at home that.
Right, well, maybe you can mention it to
Yeah,
the son and
just kinda- that would
say,
make it easier.
you know, this might be the
Yeah, I talked
easiest
to her.
solution, but otherwise he may have to just pay to get it installed, so she's, but if it's for her safety,
Because he picks up the chair as soon as she's out, like he wants it normal again. So
Right.
that's what she's, I could tell that she's like, I don't want him to, but for her safety.
right, then maybe the removable ones might be ideal.
Yeah.
Well, the actual social worker and nurse, they're pretty good at kind of smoothing that stuff over
Yeah.
to the
Absolutely.
son.
Okay.
Yeah, the social worker might be a good idea.
Okay.
And we also have some charitable funds that may be able to purchase it if they can't afford it.
I could just also let them know that I've used it and I know that, you know, if you leave it there and it gets wet, it's gonna loosen, that can happen, but,
Right.
okay, I'll keep that in mind.
Number 9, brushing a client's hair too often can cause pressure sores on the scalp. False, that's right. Leaving the hair in tangles can cause pressure sores. Hair should be brushed thoroughly at least once every day. And number 10, the risk of falling is high when clients get
In and out.
in and out of the bathtub.
That's what.
Studies have shown that getting in and out of the bathtub presents the highest risk of falling in the bath. Are there any questions?
Can't get out.